you want to talk through it?
Hip pain. Like this client, a female in her 60s, came in for a baseline assessment and sampling of her motor control system, and so I'm just reviewing the initial consultation to write down what she told me and start to build her profile as we collate all of this information. She's had pain in both hips. She has knee pain bilaterally. She reported low back pain. She has had multiple motor vehicle accidents and whiplash incidences, injuries. She's been falling a lot recently. She's had cortisone shots in both hips recently. She's been receiving chiropractic care and acupuncture for many, many years. And she's interested in me helping her to be able to move around better in her work environment, help her with the hamstring and lower extremity pain that she has with exercise, and wants to return to walking a little straighter. She walks, she reports, in not a normal way. She's afraid to lift anything without hurting herself, and she feels like she's just lost control over her limbs. So she has multiple physicians and doctors that she works with. She takes 4 different medications for depression and allergies and pain and blood pressure. So she has lumbar, degenerative joint and degenerative disc disease, high blood pressure, bilateral hip pain, depression, and stress. Takes a lot of nutritional supplements. She's had LASIK surgery, had her tonsils removed. When she was younger, she had a pelvic inflammatory disease. She played catcher for a women's baseball team for 12 years. She's had 3 cortisone shots in her right hip. Physicians suspect a hernia. Put a question mark there. She recently had a shoulder injury where a heavy board fell on her right shoulder. Bruxism. She wears a mouth guard. Her primary or fundamental objectives are, again, to keep from tripping when she walks. She trips over her own feet. Keep from tripping. And she wants to be able to bend over to pick things up off the ground. She's fearful of that. And she wants to increase her upper extremity strength and get rid of her lumbar pain. She has difficulty getting off the floor, uses a TENS unit, ice packs as she feels like she needs. She does not exercise regularly and hasn't her whole life in any formal way. Right hand dominant, 65-year-old female. possible spondylolisthesis. She wasn't sure, but someone mentioned to her that that might be the case, so we'll find out some more about that. Resting heart rate 73, blood pressure 115/85, resting respiration rate 15 cycles per minute. Extremity girth, her right upper arm is about minus a quarter inch from the left. Her left forearm is minus 5/8 of an inch compared to the right. Her left upper thigh is minus an inch compared to the right. Her right calf is minus 2 inches compared to the left. Oh wait, oh, I'm sorry. 3/8 of an inch. Difference between her left calf is smaller. And her left lower thigh, minus 3/4 of an inch difference. Left ankle, minus a 1/2 an inch difference. Standing posture, she tends to lean left off vertical plumb. Her head is tilted downward to the left slightly. Her right scapula is relatively more abducted and elevated than the left. Her right iliac crest appeared to be a little more elevated than the right. Her right ankle looks a little bit generally more pronated than the left. She tends to lean forward a little bit as well, so she's forward and left off vertical plumb. Her left knee tends to be a little bit more extended when she's standing, and she is a little bit left rotated while just standing. Her right shoulder is elevated relative to the left, or the left is depressed relative to the right. And she has a pretty significant right valgus on her right knee, and her body weight distribution, she is plus 20 pounds onto her right leg. When she lies supine, her posture, she generally is left leg internally rotated, right leg externally rotated. The right knee is more flexed than the left knee. She stays relatively the same with her shoulders and head and neck from standing. Their right shoulder's elevated and left shoulder's depressed relative. Right scapula tends to be a little bit more protracted than the left. She looked left rotated in her pelvis when she lied down, and then her hips changed to left being elevated while lying supine versus standing, and she was generally left lumbar flexed. And she had pain lying flat on the table, but when she lifted her left leg into flexion, the pain went away. Her pre-range of motion stability action reaction screen showed a right and left hip abduction low quality with pain elicited on the left. Post range of motion stability reaction action screen, she still had left hip pain, but the quality of control was better, but she was right and left low quality and hip flexed abducted and internally rotated with left hip pain or back pain. This knee did not extend as well as the right knee. This tibia.
That's sagittal pain, isn't it, Red?
Yes, red is sagittal. This tibia didn't internally or externally rotate as well as the left one. This shoulder went into upward rotation sooner than the left one, and same thing with flexion. Continuing the motion, symmetry exam. The left hip had relatively less internal and external rotation. She could not flex or lift her leg off of the table while supine very well. The right she couldn't lift at all. The left she could, with a pain of 5 on a 0 to 10 scale. Her right hip abduction was more limited than the left. Her right ankle plantar flexion was more limited on the right. Her right hip did not hike as well. Left lateral lumbar or right lateral lumbar flexion. Right shoulder flexion was confirmed. Right shoulder frontal plane confirmed. She had more difficulty in motion rotating her head to the right, and also lateral cervical flexion, and she had difficulty raising while prone her hips into extension, which elicited right calf and toe cramping with low back pain of 5 to 6 on the pain scale. And she could not retract her right scapula while prone. And that was the end of the assessment of the samples in sample set 1. Her allostatic load score is a 26, which is a 2, which is going to make us a little bit more risk averse in her exercise prescription.